Hello again, and welcome back to my channel, Quick Healthcare Insights with Dr. Stephen. I'm glad to have you back today, and today we'll talk about an infection that most people aren't aware of. Have you ever heard of listeriosis? 6 people wound up in the hospital earlier in August due to a bacterial infection known as listeria. Unfortunately, 3 of the 6 people died. All 6 people had conditions that predisposed them to getting bacterial infections. The local health department was able to link the infection to poorly cleaned ice cream machines at a local hamburger restaurant. Also, the local health department said that it found Listeria bacteria in all of the restaurant's milkshake flavors. It appears that exact same strain of Listeria bacteria that infected all 6 people matched the strain of Listeria that was in the local restaurant's milkshakes. What is Listeria? Listeria is a specific type of bacteria. It can contaminate many kinds of foods, including raw fruits or vegetables that have fertilizer or soil on them, unpasteurized dairy products, especially soft cheeses, meats, fish, and particularly deli meats and salads that are served cold and not cooked properly. When someone eats foods that are contaminated with the Listeria bacteria, they can get infected with the bacteria. This infection is called listeriosis. Recalls of foods that are contaminated with Listeria are not uncommon. The United States Food and Drug Administration regularly issues recalls of different foods that have been contaminated with Listeria. Be aware that Listeria bacteria can survive refrigeration and even freezing, so they're a really tough little bug. Most healthy people age 64 and younger who consume food that's contaminated with Listeria will not get sick, or in the event that they do get sick, the disease is usually relatively mild. Listeria usually causes significant symptoms in people whose immune systems are weakened. This includes newborns, people over the age of 64, and people who otherwise have weakened immune systems, such as those being treated with drugs that suppress the immune response, or people who have diseases that innately suppress the immune system. Pregnant women who get listeriosis usually have mild or no symptoms at all, but the main concern about listeriosis in pregnancy is that the infection often causes miscarriage, stillbirth, premature birth, or even life-threatening infection in the newborn. Let's talk now about symptoms and treatment of infection. Symptoms of infection can begin several days after eating contaminated food, but it's important to remember that symptoms can take as long as a month or more to develop, depending on the particular case. Typical symptoms of Listeria infection that's localized to the intestines include diarrhea and vomiting. However, when the infection spreads beyond the intestines and becomes serious, this is referred to as invasive disease, additional symptoms can develop, such as fevers, muscle aches, headaches, stiff neck, confusion, or even seizures. Of non-pregnant people with invasive listeriosis, most will need hospitalization, and somewhere between 1 out of 6 to 1 out of 20 typically die from the disease. The Centers for Disease Control and Prevention, known as the CDC, estimates that Listeria is the 3rd leading cause of death from foodborne illnesses in the United States. Most Listeria infections in otherwise healthy children and adults are relatively mild and go unnoticed. If the symptoms are relatively mild and limited to diarrhea, be sure to stay hydrated with fluids and electrolytes. However, In serious and invasive cases, treatment with antibiotics is required. Let's talk now about how to prevent listeriosis. This is particularly important for people who are at high risk of the infection, which I discussed earlier in this video. As with many infectious diseases, prevention is the key to avoiding listeriosis. Keep hands, cooking utensils, food preparation surfaces clean. Thoroughly clean raw vegetables and fruits. And cook thoroughly all meats, poultries, fish, and egg dishes to safe temperatures. If you're in one of the high-risk groups, add the following precautions. 1. Avoid soft cheeses and other dairy products that may have been made with fresh, unpasteurized milk. 2. Ensure that hot dogs and deli meats are thoroughly cooked. 3. Thoroughly cook all sprouts. 4. Avoid refrigerated meat spreads because these can contain listeria when they're manufactured, and as discussed, refrigeration and even freezing doesn't kill listeria bacteria. And number 5, only eat fresh smoked seafoods if they're adequately cooked in another dish. If you have any questions or concerns, discuss them with your qualified healthcare provider. Don't try to self-diagnose or self-treat. Until we meet again in the next video, as always, stay healthy.